Hello, everyone, and happy long Easter weekend. Amongst um, other online services and more intimate family festivities this weekend, consider hunting for a Brio Facebook Live talk to treat your mind, body, and spirit, and give it a break from the news and streaming services that so many of us are relying on. We continue to provide these talks to our community in hopes of sharing our collective wealth of knowledge near and far during this unprecedented time of need. A large part of what we do as naturopathic physicians is prevention as well as education. Uh, you are joining me today, Dr. Vanessa, with a special masterclass on managing cardiovascular risks and living a heart-centered life through the Brio Living lens. There's already been a couple of master's classes discussing this Brio Living lens that we promote at the clinic, which involves 4 stages, which are first weeding, seeding, feeding, then thriving, using the analogy of a garden to compare our bodies to. In this talk, we'll largely cover the weeding and seeding phase. So before I get into the meat of this talk, just do a little recap. So 3 weeks ago, I was recording my inaugural Facebook Live video. It was an introduction to mind-body medicine. It seems like much more time has passed in this coronavirus-driven alternate reality. Yet I still clearly remember my heart pounding in my chest. This is part of the physiological effect of anxiety on our bodies. And the purpose of this is to concentrate blood flow to our brains where we need it to make split-second decisions. When our breath rate and our heart rate quicken, it results in rapid, shallow breathing, as well as palpitations. Since then, my distressed deer in headlights response to speaking to you live has been downgraded to eustress, or the moderate or normal degree of stress, which is supposedly beneficial for the experiencer, although it doesn't seem that way at the time. I owe part of this to following my own advice. In other Facebook Live sessions, I've dove into therapeutic breathing techniques for relaxation and energy, and most recently, goal setting. As I've mentioned before, there's only one thing separating anxiety and excitement, and that is breathing. While I'm not there yet, my goal is to feel at ease and excited before, during, and after I give a Facebook Live presentation. And I want to do this by summer solstice, the longest day of the year. I won't bore you with the details of my 10-point plan, but I can happily share that we're in the process of planning the next lineup of talks spanning until early June. By then, I will have had the opportunity to do at least 6 regular talks and 3 extended master's classes, including today. Sometimes a trial by fire approach is not only effective, but necessary to do those things that we find the hardest. But I digress. Today's talk is about taking care of and protecting our hearts. I've called it Managing Cardiovascular Risks and Living a Heart-Centered Life Through the Brio Living Lens. For those of you who don't already know or haven't caught on, I really like puns. So I'm not talking about heart-centered in the philosophical way, as in choosing love and compassion as the guiding principles of your life, although there are benefits to that, or living in alignment with your true self, although taking care of your body and following your heart as a way to live your life, again, are beneficial. I mean it more literally. Um, Today's talk is all about the heart. So, cardiovascular disease, what is it? It encompasses three highly undesirable outcomes, including heart attack. The technical term for this is a myocardial infarct, or MI, angina, chest pain, and lastly, stroke. So these three conditions, again, heart attack, angina, stroke, specifically when caused by narrowed or blocked arteries. So imagine that this is a normal, healthy artery or blood vessel. It can become narrowed or blocked, occluded. This happens through a process known as atherosclerosis. As I mentioned, it can be narrowed, blocked, and blocked can be fully or just partially. My fist represents a clot or thrombus that can form on the inner wall over time. And things like what we're eating, sugar, cholesterol can contribute to plaque formation on the tunica intima, the innermost layer, and those two things can also affect the turbulence of blood flow coming through that further roughen up the inside of the lining. In atherosclerosis, fatty deposits or plaques do build up inside, causing a thickening and stiffening of the artery walls. So instead of constricting and dilating as normal with a normal, healthy, flexible, responsive wall, it's doing something more like this. This impedes blood flow, not only to tissues throughout the body, but also organs, causing ischemia, which is an inadequate amount of blood supply, especially when used in reference to heart muscles. And what do you get? Chest pain, and if we're unlucky, a heart attack or a stroke, when too little blood reaches the brain. Does everyone remember what you must do when presented with a stroke? I've seen this at bus stops, this acronym posted. Think fast is what you should do. F stands for face. This helps you recognize if someone is having a stroke. Is there any facial drooping? The next letter in fast is A. Their arms. Are they able to raise their arms? If they can't, it's not a good sign. Speech. Is there any slurring? How responsive are they? And lastly, T, the final letter in fast, the time to act is now, to act fast. Brain tissue gets damaged and dies within minutes. The heart is one of the most intricate organs and will only have time to cover the conditions specified. However, there are other forms of heart disease affecting the myocardium or heart muscle, as opposed to the vessels they supply. The talk is focused on the vessels. It's valves, so heart valves, as well as rhythm disorders. We won't have time to cover those today. So, what are signs and symptoms of cardiovascular disease? And more importantly, an acute, so sudden or impending cardiovascular event. These things include chest pain or discomfort, also known as angina, a feeling of pressure or tightness in the chest, shortness of breath, nausea, fatigue, neck and jaw, throat, even upper abdominal pain as the bottom of the heart does extend there, back pain, pain, numbness, weakness in anywhere in your body, coldness in your extremities, your arms or your legs. You may already have some peripheral artery disease or claudication in or cramping in your calves. Some more generalized things like a sense of impending doom or panic, palpitations, flushing or warmth may occur. And it's worth noting that many of these symptoms and signs may overlap with the effects of anxiety or stress on our body. Sometimes it's referred to as a silent disease, and you may have little to no warning before your first event. Having a heart attack may be what notifies you to having these internal issues. So that was a bit of a heavy introduction, but what I'd really like to focus the rest of this talk on is the fact that many types of heart disease can not only be prevented, but also treated with healthy lifestyle choices. So that's where we're going to be going. I want to start with addressing the various risk factors. There's two types. There's the correctable or modifiable, as well as the non-modifiable. So there's a really extensive list of things that are within your control when it comes to a cardiometabolic disease, such as an unhealthy diet. So a diet consisting of a lot of high fat, high sodium, high sugar foods, one that's heavy in refined or processed carbohydrates, as well as cholesterol. These all contribute to that plaque formation that we don't want. Cholesterol isn't bad entirely, it's just about the amount. As with all of these things, I always recommend, and even myself, ascribe to the 80-20 rule. So eating well 80% of the time and enjoying treats 20 of the time, a lot less, but during a special occasion or choosing when to indulge. So diet. Another one is a lack of exercise, chronic stress. Smoking. Nicotine constricts blood vessels, and the carbon monoxide that's released also damages that inner delicate lining of the blood vessel. Uncontrolled high blood pressure can also sclerose or harden the arteries. Uncontrolled diabetes. Being overweight as well, having a BMI greater than 25 often worsens these other risk factors. There are also better objectives for measuring a person's overall cardiovascular risk, including waist circumference and waist to hip ratio. So The numbers that you should aim to be below are as follows. For men, um, anything greater than 40 inches, 102 centimeters, and for women, anything greater than 35 inches or 88 centimeters puts you at higher risk. And I'll show you how to measure this in just a moment. There are also adjustments made for various ethnic groups. This is important to note. So for anyone greater than 40 inches or 35 inches is highly undesirable, but you may not have as much of a range to work within if you're of the following ethnic groups. So if you are of European descent, the recommended numbers to stay below are 37 for male and 31.5 inches for females. For South Asian Chinese or Chinese, for males, 35. So that was the equivalent of the generalized female of other ethnicities. And for female, same as European, 31.5 inches. Interestingly, there's a separate category for people of Japanese descent. You should aim to be below 33.5 inches for a male, and there's actually a larger allowance for females. A difference in this ethnic group compared to the other ones, where females actually have a larger limit, and that is 35.5 inches. There's lots of numbers, and it may seem kind of abstract. I will post a table along with the summary to illustrate this. So another measure, which is better than body mass index, is the waist to hip ratio. Now, this is a measure of abdominal fat relative to lower body mass. A healthy waist circumference to hip circumference ratio is less than 0.9 in men and less than 0.85 in women. A waist to hip ratio of greater than 1 increases the risk for heart disease and other morbidities. Again, it's more accurate than BMI, and a healthy BMI is considered anywhere between 18.5 to 24.9. There are many calculators online to compute the BMI using your height and weight. So to measure your waist and hip ratio, I'll try to illustrate this the best I can with the space given. So I've got this measuring tape here. If you don't have one flexible measuring tape, you can always use a piece of string or ribbon and then hold it up to a measuring stick or ruler after the fact. So for the waist, you're going to want to find the top of your hip bone. So try to wear something that will show it better. Okay, so there's my waist, the most narrow part, and there is the top of my iliac crest or hip bones. And you'll notice that your belly button falls right about in the center, so that's also a good landmark. And you'll just make sure to keep your measuring tape parallel to the ground. As you can see, it can be very helpful to have someone help you with this. And what I forgot to mention was the setup. So just standing up straight, and you want to breathe out a couple of times just to relax your midsection. It's about honesty here and not looking good. So we've mentioned the waist measurement. Next is the hip. So this is also using your hip. So before we used the top of the hip bone, and now this is lower down from a side view, it might be easier explained. I'll just do an anterior pelvic tilt. It will be the widest part of your buttocks. So that's where your second measure will be for obtaining the hip to waist ratio. And then it's as simple as dividing your first number of your waist over the bottom number, your hips, and you want to see something below 1. Okay. So we've talked about quickly the modifiable or correctable risk factors, and I'll get into more detail on what you can do for those later on. But I also wanted to bring up what's not modifiable. So the things that we're born with that may put us at greater risk of cardiovascular disease, which is why it'll be more important for some over others to focus their efforts on the things that we can control. First thing is family history. So if you have a first-degree male relative with coronary artery disease, first-degree male relative that's younger than 55 years old when it happened, or a first-degree female relative that was less than 65 years old. That's considered relatively young to have either a heart attack or a stroke. Increasing age. There is something called the Framingham calculator that I will bring up later, and you get different points for each decade of life, starting with being over 35. So just aging alone will put you at an increased risk. Also, what sex you are. So males have a higher risk than females. That is until menopause, as estrogen has a protective effect on not only bones, but the heart as well. If you are receiving cancer treatment, certain chemotherapeutic drugs, such as anthracyclines, trastuzumab, and midazolam, as well as high-dose chest radiation, can cause cardiotoxicity. And finally, chronic kidney disease. You are at higher risk if you also have poor functioning kidneys or are at end-stage renal disease. I've been talking about cardiovascular risk, and I did mention lack of exercise, prolonged sitting, something that we do common with the types of jobs that most of us have. So I just wanted to apply some of my own advice right now. We're about halfway through this talk, and I'm just going to guide you through a little activity right now that's inspired by traditional Chinese medicine. And we might do it again in a moment. Okay, so here is a chart, there we go, of the 5 different elements. We have metal, which generates water. Oh, this way, generates water. Water produces wood, it helps things grow. Wood then yields fire when we burn it. Fire generates earth. It breaks things down and puts them back into the earth. And finally, earth is a source of different metals. So we'll be going through this cycle. I invite you to just make a couple of fists with your hands, and we're going to use these to gently tap on the various organs in our body that correspond to these 5 elements that I just discussed. So we'll start with the lungs. Let's go up and down. So this direction or this direction, whichever you find more comfortable. we'll just be tapping on our upper lungs and then our lower lungs along our rib cage. And as we said, metal generates water. So the next organ in the generating cycle is the kidneys, and they correspond to water. So a back view here, just finding the bottom of your back ribs and just tapping above there. This is also a good thing, a quick test, kind of to simulate a kidney punch if you're worried about a urinary tract infection that's progressed further up the system. So water produces wood, that's the liver. Corresponding organ is the liver, and that's on the right side of the body, just under the lower part of your rib cage. So we'll tap on our liver. Liver or wood yields fire. Fire corresponds to the heart organ, so it's more central here, slightly to the left of your sternum. We'll tap there. Heart, and what does the heart do? It generates earth, and that's your spleen. So the opposite of where we had the liver, on the left side now of your lower rib cage, that is your spleen, corresponding to earth, and the earth produces metal. Going back to the beginning, our lungs. So we'll tap, and that completes the cycle. Okay, we'll do that again later for those of you who missed it or aren't sure what's going on right now if you're coming in at the middle. As I mentioned earlier, one of the things that we must do if we're concerned with optimizing our cardiovascular health is to quit smoking. So this is a very difficult substance to stop using. Just gonna find my notes here quickly. Okay. So just some evidence behind this recommendation. So when you do quit, you're decreasing almost immediately, within just 20 minutes, all your vital signs are returning to normal. So that's your blood pressure, your heart rate, your body temperature. Within 24 hours of ceasing to smoke tobacco, your heart attack risk begins falling. Just one day. In fact, your risk of developing heart disease is half that of someone who still smokes after 1 year of smoking, which is quite significant. This is one of the things that will have the biggest impact. Well, I personally don't have any experience with quitting tobacco. I understand that the first few days will be the toughest due to withdrawal symptoms, and these tend to spike within 2 to 3 days and last up to a month or longer. So be patient with yourself or those who have people in your lives who are trying to quit. An easy thing, of course it's easier said than done, is to think of the 4 Ds. This can actually be applied to any oral addiction, whether it be a controlled substance or even food, which might be more applicable to the audience I have right now. So first D, delay cravings. Second D, drink water. Third D, distract yourself. And the fourth and last D is to deep breathe. So when you notice that you're having a hankering for something, whether it's a cigarette or a food that you know isn't the best choice for you, think of these 4 things. Again, delay the craving, drink water, distract yourself, or deep breathe. So continuing on with the things that we can control, exercising. At least 30 minutes or more most days. I'd say at the very minimal, 2.5 hours per week. So you're getting 2 days off, and you can structure that however you want. Regularity is important, but everyone gets busy, so maybe just have a longer workout on the weekends when you do have more time, or whenever it is in your schedule. So we mentioned before watching sodium, sugar, cholesterol, alcohol. I don't think I've mentioned yet. Processed or refined carbohydrates, and limiting saturated fat in the diet. I'm going to spend a little while on saturated fat because it's not necessarily about eliminating it altogether. There are some better choices you can make, though, in this category. For now, it's just important to note that it's really the man-made hydrogenated saturated fats, or trans fats, that are the ones to avoid. Some good news. In fact, in 2018, Canada and the US passed laws that ban partially hydrogenated vegetable oil. This is an artificial form of trans fat. Trans fats are naturally occurring in modestly small amounts in dairy products and red meats in particular. There's much less in white meats like chicken and pork. They did this along with many other countries as a part of Replace, a World Health Organization initiative to eliminate industrially produced trans fat consumption due to its links with rising rates of heart attacks and heart disease worldwide. Trans fats not only raise bad LDL cholesterol, but they also lower the good or beneficial form known as HDL, high density lipoprotein, as opposed to low density lipoprotein. Research shows that such a ban could prevent upwards of 12,000 heart attacks over a 20-year period in Canada. I think that's quite significant. Previous strategies such as mandatory labeling of trans fats and banning the sale of snack foods containing it in schools were not effective enough. Further, retailers will be given 2 years grace to clear out their existing inventory, so you may still find some products on shelves that were produced prior to the ban, but absolutely by 2021 there shouldn't be any kind of trans fats on shelves, which will help to streamline food buying decisions. You have so many options these days. Other things that I have mentioned are to monitor and manage hypertension, high cholesterol, diabetes, and kidney function. Both your conventional and naturopathic doctor can perform various physical exams and order labs to not only test your levels for baseline, but also to measure treatment response. Okay. So a big thing with exercise, just a few more tips and specific advice. So I already said 30 minutes almost every day. If you can do 60, even better. At least 2.5 hours over the course of a week. For those of you who wear Fitbits or different devices with pedometer, the magic number for a number of steps that you'd want to aim for is 10,000 steps. So for those of you who drive, it may be harder. So take breaks from your desk, go out for a little walk. For those of you who take transit, maybe get off a few stops prior to your destination. That being said, those of you who are driving can also park further away from your destination. A basic weekly recommendation or recipe for how exercise can be selected, because of course there's different kinds for cardiovascular health, flexibility, toning, and strength. So, about 150 minutes of moderate aerobic activity. Things such as brisk walking, dancing, gardening, even housework, and actively playing with kids or pets um, does count. In terms of strength training, moderate also refers to lifting loads of less than 20 kilograms or 44 pounds. So 150 minutes of a moderate aerobic exercise and 75 minutes of the vigorous aerobic exercise. So that would include things like hills or stair climbing, jogging, cycling, aerobics, and with strength training, working with loads or weights that are greater than 20 kilograms or 44 pounds. Do aim for at least 2 or more strength training sessions per week. There's a few therapeutic diets out there, including one that's used by dietitians and in hospitals, and your family doctor may have even mentioned this one called the DASH diet, which is dietary. I'm forgetting the A now. I think it's dietary advice for stopping hypertension. The A might not be right. If anyone wants to look it up and let me know, that'd be helpful. So DASH portfolio diet, this one is more for managing cholesterol. That involves eating a lot of different nuts and legumes for their healthy plant sterols, and the Mediterranean diet. And there's even some that are a hybrid of these. I mentioned before that I would get deeper into what are healthy fats, because it almost seems like an oxymoron based on previous decades of health research when fat-free was really the fad, but then they learned later that there are benefits to consuming fat, and we're seeing things swing the opposite way now with very high fat diets like Atkins and ketogenic. So healthy fats actually do help reduce triglycerides, blood pressure, and clot formation. Good choices for cooking oil include olive oil, avocado oil, and camelina. I used to have all of these in my kitchen for various projects, but here we've got a extra virgin avocado oil, and that one's good for high heat. So is the camelina. That one also has a high amount of omega-3s, which is quite rare for a cooking oil. It's also, due to that, has a bit of a nutty flavor. Saturated fats. So saturated fats are solid at room temperature and liquid when warm. They include animal sources like grass-fed butter and ghee, which is clarified butter. Anytime butter is grass-fed, or if it comes from New Zealand, this kind of happens by default, it'll be a high source of butyrate or butyric acid, the short-chain fatty acids, which are really great for gut health. So these are my recommendations for animal sources of saturated fat. Clarified butter is a staple in Indian cuisine. It is much more concentrated in fat, as a small amount of water and milk solids have been removed. This makes it more tolerable for those who are lactose or casein sensitive. The clarification process both helps the butter from spoiling in warm weather, increases its smoke point, so how high you can heat it, makes it good for baking, and it also gives it a slightly sweeter texture. However, the clarification process may form oxidized cholesterols. Saturated fats also come from tropical plant oils, such as coconut. Coconut oil is immune enhancing and antimicrobial due to the medium chain triglycerides. I've got one right here. MCTs help improve digestion and nutrient absorption and has been even known to reduce inflammation. The last thing is red palm oil. I do hesitate a bit to recommend this ingredient as there are deforestation and human rights issues with most of the world's production of palm. However, the Roundtable of Sustainable Palm Oil, or RISPO, is trying to establish industry standards relating to these concerns and increase the use of sustainable palm. As it stands, about 14% of global palm production is now certified by RISPO. All that aside, red palm oil is heart and brain beneficial. It reduces cholesterol, oxidative stress, progression of heart disease, and possibly even dementia, to name a few. This is owing to the tocotrienols. This is part of the vitamin E family, the mixed carotenoids. These are plant pigments that give fruits and vegetables their bright red to violet, yellows, and orange hues, as well as palm oil's reddish tint. Beta carotene specifically is a precursor to vitamin A, but some people have some SNPs or genetic mutations that inhibit the ability to convert plant-based beta carotene to vitamin A for use in the body. These benefits are largely found in unrefined palm oil only, though. It may be hard to find, and as an alternative to Crisco, lard, those types of things in baking, you can use palm shortening, red palm shortening. It can also be replaced by a 50-50 mix of grass-fed butter or ghee and coconut oil. Some other dietary recommendations, 2 to 3 servings per week of cold water fatty fish. This includes mackerel, herring, sardines, tuna, salmon, trout, as well as cod liver oil, which is rich in vitamin A and D and good for developing brains. Fish oil supplements. Now, I would still recommend eating 2 to 3 servings of fish per week. Try to have a variety of those sources mentioned already. Some, such as tuna, will be higher in mercury due to bioaccumulation at higher trophic levels of the food chain. So fish oils, look for one that is third-party certified and clean, because you'll be consuming such large amounts. It's no longer just medicinal food, but a supplement itself, so it's highly concentrated, so any traces of contaminants will also be concentrated. Fish oil supplements can be appropriate if you don't like fish, and also just for really anti-inflammatory effects. Alpha-linolenic acid, or ALA, is the omega-3 found in plants. Most commonly, people will use flax oil, but other nuts and seeds, chia, walnuts, those things will also have the ALA. However, like beta carotene, it needs to be converted to an active form to be used by the body, and not all of us are good converters. Between 5 to 20% of ALA gets converted to EPA. EPA and DHA are the types of omega-3 that are found in marine animal sources. EPA is anti-inflammatory and has cardiovascular health benefits. Between 0.9 to 9% of ALA gets converted to the other form of marine animal omega-3, which is DHA. This form is known for its brain and cardiovascular benefits. While conversion rates of ALA fall within these fairly wide ranges, it does increase in the absence of EPA and DHA in the diet. So if you are a vegan or vegetarian, your body will absorb more if you don't have an issue with conversion in the first place. Those who are strict vegans can always take an algae oil as well. After all, it is what the fish are eating to get those EPAs and DHAs, so that's a more direct source. As mentioned before, whether they have omega-3s or not, they're also very high in fiber. Seeds like chia, flax, hemp, sesame, pumpkin, sunflower. Some of the best nuts for heart health are walnuts, almonds, macadamia nuts, hazelnuts, and pecans. And yeah, I think that's the extent of my list. I didn't go into as much detail with some of these, but I think you're getting the picture. So saturated fat is not bad in itself, especially coming from these more beneficial sources that have health benefits that warrant their consumption, but I would still limit it to 1 to 2 tablespoons per day. Saturated fat, I did mention, naturally occurs, saturated and trans fat, naturally occurs in meat products and full fat dairy. So if you are consuming a lot of dairy, anything that's less than 7% won't have as much of the things that we don't want. I mentioned earlier that nuts are a good source of fiber. So 5 to 10 grams of soluble fiber per day can help to decrease the so-called bad cholesterol. You can get fiber from beans and legumes, things like kidney beans, peas, lentils, seeds of various kinds, whole grains even, oats, barley, bran products. That can be bran of wheat, oat, or rice, and even some fruits, apples, pears, bananas, berries, and citrus fruits. The last thing I wanted to talk about in terms of prevention and management of cardiovascular disease is sleep. Deprivation of sleep increases the risk of obesity, hypertension, heart attack, diabetes, and depression. 6 to 8 hours per night, I think we've all heard this before, is what most people need. It's also important, this has been talked about in other talks, that it's valuable to sleep and wake at consistent times every day, even on weekends. To investigate any sources of unrefreshing sleep, including obstructive sleep apnea, which can be more prevalent amongst the subset of people who have risk factors for cardiometabolic disease. Speaking of risk factors, I haven't forgotten that I was going to bring up the Framingham risk calculator. So this is probably really too small. Again, I will post that on the summary of this talk, but it essentially gives you a score for what your 10-year risk of cardiovascular disease will be as a percentage. So it factors in age, for example, starting at 35 to 39 years of age, men get 2 points. For women, the same age, 2 points. And goes all the way till 75 years of age, where you get 15 points for the age category alone. Whether you smoke or not, whether you've been diagnosed with diabetes, what your total cholesterol levels are, your systolic blood pressure, so that's the top number, you actually get -2 points if you're less than 120 on the top number, and up to 3 points if you're greater than 160 systolic, the top blood pressure number. What your levels of the good or healthy HDL cholesterol are. And all of that comes together. And so if you have 3 points, for example, your 10-year risk is 2%. So that works out to be 1 in 50. You have a 1 in 50 chance of having a cardiovascular event. If you have, say, somewhere between 17 and 18%, or 17 and 18 points, sorry, the risk then is closer to 20%. So that's 1 in 5 people. So like the BMI calculator, the hip to waist ratio, and now the Framingham risk calculator, all of these things are available online if you want to check them out. And I've just noticed that my time is running out here. I've gone a little bit over, but I'm just going to wrap up for those of you who want to stay with me. We'll just take a little break before I finish off. I mentioned that I'd review the tapping exercise with the 5 elements because I'm going to explain why I wanted to do that in the first place. Okay, so the second time around, a little with more gusto this time. Starting at the lungs, we're going to tap on the upper and then the lower over the lungs, and then moving on to the kidneys, lower ribs just slightly above the kidneys. We're doing this to wake up the different meridians in our body. Moving on to wood on the right lower side, liver, which yields fire going into our heart. And then moving down to the spleen and back to the lung. Okay. So why I wanted to talk about this was the effect of stress on cardiovascular health. And I'll bring up this chart again with the 5 elements. So this is the generating cycle, and then this is something known as the controlling cycle, if you were to draw a star in the middle. And so anxiety and depression is something that people are feeling more and more. And in the TCM view, depression is seen as a lack of fire. The emotion, fire. The emotion associated with the fire is actually joy. So that makes sense, right? That if you have a lack of joy or happiness, that you could be feeling some depression. Fire generates earth. So here we go, this way. The emotion corresponding to earth is overthinking, worry, really. That's the anxiety piece. So they're connected. Earth then generates metal. With metal, um, we have things like sadness and sorrow. Okay? And when you have too much sadness and sorrow, that can turn into anger. Some people have been commenting that they're feeling a lot more irritable these days during the quarantine. Um, this may be a response to the sense of loss. An excess of joy, so down here, also causes a dispersion of energy. It gets dissipated and lost. Think of a kid that's come back from a birthday party or Sunday morning after a night out on the Granville Strip. When we have an excess of joy, it can make a person feel dizzy, weak, dry, and exhausted. So that is just to say that managing our emotions is a big part of taking care of ourselves, including our heart, which in the Western sense is really the seat of emotions. But as I've just shown with the TCM generating wheel and with exercise, that emotions are stored and associated with all parts of our body. So today we really did just talk about weeding, the kind of pain points and things that we want to get rid of that aren't serving us in our lifestyle when we're trying to manage our risk, and then seeding, replacing them with better choices and better habits, and then what would come after in the Brio living cycle is the feeding. So that's the healing process. These changes won't happen overnight. Oftentimes, the numbers won't seem to really bulge, but a better gauge of it might be how you're feeling. The empowerment that comes from, not letting your condition get the best of you, not identifying your personality, your person with someone who has X, Y, or Z. And once you've reached the feeding stage, that really opens up your world to not just managing the risk any longer, not being in that fear state that's associated with the water element and the kidneys that we were tapping on, but opens your world to putting those efforts towards things that really do bring more joy and happiness in your life. So with that being said, thank you for joining me in this hour of talking about how to manage cardiovascular risk from a heart-centered view and just touching on a little bit of Brio living. Enjoy the rest of your long weekend, and I'll be with you again soon. Thanks.